Hey South Plains, Amanda McAfee with Lubbock Area United Way. Today I'm joined by a few people, and we have Nancy Trevino, who's with the Health Sciences Center, Beth Lawson, who is on our board and also the CEO for StarCare, and Cristy Martinez, who is with Family Counseling Services, one of our community partners. And we wanted to bring them in because we wanted to do an updated conversation about mental health in the middle of a pandemic, in the middle of racial injustices and the outcries around that. And just look at what resources, talk a little bit about our resources available in our community, talk about a little bit what the mental health landscape looks like in Lubbock, both prior to COVID-19 and now as well. We talked a little bit about that back in March with Cristy, but we want to continue that conversation because things have changed and our mental health needs have changed over time. So thanks everybody for joining us. We're very happy to have you here with us today. Nancy, let's start with you. What did mental health in Lubbock, Texas look like before everything got started? Let's just start with a ground pace of what we had available to us and what were some of the general needs and concerns for Lubbock before the pandemic starts.
Well, thank you for having me. One of the things that we had in our community prior to the pandemic is we had a great group of leaders that got together and were already looking at what do we have in our community for mental health and what are some of our gaps, what are some areas that we can improve. And so that group got together and worked to commission the Lubbock Area Comprehensive Mental Health Needs Assessment with the Meadows Mental Health Policy Institute. And so the Institute came out and they talked to over 200 individuals within our community to look at our mental health things that we had available to us and some areas that we could improve. And one of the things that we were really proud of in the findings of that Meadows report is that they talked about we have a lot of collaborations. We have a lot of great resources within our community. But they did identify some areas where we could improve, and coordination was one of those areas. And so I'm happy to say that and give an update that we are working on coordination through the West Texas Mental Health Partnership. That is the group that commissioned the Meadows report, and this upcoming month we'll be able to discuss that more. We'll plan on holding a press conference and releasing that to the public. And so Ms. Lawson was one of our partners in that. We know that there are some gaps in our continuum of care. So we are working to bring greater resources for mental health for youth and their families. We're also looking at the inpatient capacity, looking at growing our workforce for mental health, and then also looking at our crisis response for mental health. So those are some of the areas that we knew we needed to improve on from our Meadows findings, and that was before COVID. COVID changed our world a little bit. It's brought about greater coordination among the partners, but we've also recognized that we have some really great work happening in our community with additional partners that we could bring in. And so we're looking at expanding the partnership to include additional local resources that are doing a great job, but we've been working very siloed. So just some of that coordination.
And Nancy, I think that's one of the things that we have seen more during the last couple of months is the amount of collaboration that happens in Lubbock on just a regular basis. And I know that was one of the things that I was very pleased to see from the Meadows report is just that talk about, hey, wow, yeah, we have some silo issues, but Lubbock actually works pretty well together on this issue. I think that's been one of the best findings that we could have had from that. And it's really encouraging that we can make progress when we are all working together. Beth, I know you were heavily involved in that. Anything that you would add about the climate of mental health prior to the pandemic?
Well, I think that our community has always been really innovative. And again, thank you for having me. I should have said that to begin with. Our community is very pull yourself up by the bootstraps, knowing that we're out here in West Texas. I like to talk about the frontier spirit and that we don't wait for people to come from Austin to help us. We help ourselves. And so we have always had a real spirit of collaboration, and having had that be one of the things that was pointed out as a strength in our community, it's nice to have a third party say that, because you can say it as many times as you want to about yourself and all the organizations in the community, but it does seem a little self-serving. But when somebody from the outside comes in and says, you guys are light years ahead in your willingness to collaborate, that was really, really good. And so for us, having had the benefit of that early on has really been good to help us through the pandemic as well. Because if we had to establish relationships during the pandemic, that would be very, very difficult. But we travel in the same circles. We text each other, we call each other, we email each other, and we run into each other as we live life here. And so I think for us, having had those relationships before the pandemic has really helped us respond to the pandemic well.
First, and share with us, because we know there have been a lot of new mental health needs created, some existing things that were already going on that have been amplified. So talk a little bit about what you guys are seeing as the pandemic continues.
Sure. I'm really happy to report that a lot of the people that have been accessing our services for years or even just recently are really resilient in their use of the telehealth platforms. That's absolutely something that's new for a lot of folks, in that they are used to walking into a clinic, seeing a person face to face, whether it's their doctor or their nurse practitioner. But I'm very proud of people and their resiliency to hear and see people via telehealth priority platform. And so that's been new for us. But what's been new for the bigger community is that the anxiety and unknown associated with COVID-19 has really brought forth some issues for people that don't typically struggle with mental health needs. And so the fear of what's going to happen next, or the fear of getting sick, or the fear of a loved one getting COVID-19 or passing away has really been a big deal for our our bigger community as a whole. And I think for that too, we're starting now that we're progressing through the sheltering at home or staying at home more, not going out as much. We're seeing a lot of loneliness and isolation. And so for us at StarCare Specialty Health System, we typically support people with pretty significant mental health needs, whether that's schizophrenia or a major depressive disorder or bipolar disorder. But what we're seeing are people who are now lonely, and their loneliness has been exacerbated because they can't go anywhere. Maybe they live alone and they work at home now and they don't see people. For extroverts, this has been a really tough time for people not being able to hug another person or pat them on the back. And so we're seeing a lot of folks that are starting to feel the impact of the loneliness and isolation. I will tell you that I'm excited that StarCare has partnered with the state of Texas in setting up a COVID-19 response. We have a hotline. We have counselors available to help people if they have COVID-19 related anxieties or stressors. And here in a little bit, I'll share my screen with you all to show you the phone numbers for that. But people should not be at all apprehensive about reaching out to this hotline, because these are unprecedented times with the economic situation we have, the social unrest that we have, and then also the unknowns with the COVID-19 pandemic. There's a lot to process, and if you're not eating right, sleeping right, exercising, and having some sense of a routine where you get up and put pants on, and not just your yoga pants, but real pants, you can really get into a situation where you really need to talk to somebody.
Yeah, I think there's a lot of things that are going on different for people. And I know, I'm somebody who I'm quick to find a counselor and get that mental health support. I've learned that over the years and over time of there is no shame in talking to a counselor and getting support. But, even people who feel like, I'm pretty mentally healthy most of the time, this has caused some stress and then some anxiety and some, what in the world literally what in the world is happening. I mean, I think we can honestly say literally what in the world is happening. So Beth, you mentioned the hotline and that there are telehealth options available, and that looks like that's a pretty broad variety when we say telehealth. That's everything from I'm talking to somebody on a phone to I'm actually virtually face to face with a counselor. Talk a little bit about what that looks like and what people should expect if they try to go with that option.
Sure, I'd be happy to. I think that the answer really lies in what the person is needing. And so if a person is already in our services, then they don't need a screening. They don't need to ascertain what services they're eligible for or they're already in. And so we've been doing ongoing services by, like you said, by telephone, by iPad, and the secure connection like we have right now. We've been doing virtual visits, but we've also been doing face-to-face because there are some needs in our community that need to be still met face-to-face. We are a essential healthcare provider organization, and so we suit up in the PPE and we deliver services. But I think really what we would like to focus on today is the discussion about the COVID-19 hotline. And so if you don't mind, I'll share my screen and I will show you a little bit here. Hopefully you can see it in just a second. Can you see a form that looks like it says StarCare with the COVID-19 mental health information line?
Yes, it just popped up.
Great, great. So StarCare is partnering with the State Department of Health and Human Services, the commission actually, and we are trying to help citizens just navigate through this COVID-19. This is one of the first times that really in our lifetime that a shared worldwide crisis has happened. Typically, a crisis happens in a smaller family unit or even in a community, but this is the first time in our lifetime that we have a nationwide, worldwide shared crisis. And so the Health and Human Services Commission and StarCare Specialty Health System know that there are certain needs out there in our community that are different now because of that. And so we have partnered together to pull this hotline in for our community, where any citizen can call us and talk about what they're worried about. And we have a qualified mental health professional who answers the phone, and then we'll direct that citizen, whether it is to actual counseling services, or maybe they need an intake appointment with a doctor. Maybe they just need a referral for their own employer's employee assistance program. I think what we've seen some is that people don't know that their employers have an employee assistance program that they can access, and we can help them get connected with that. In addition to that, help with utilities or with food or childcare during this has been very stressful for people. And so we do both counseling and referral. And so we also connect to ourselves for the more ongoing routine services that people might need for some of those other diagnostics of a brain disorder. But in terms of the anxiety and the information and referrals, this is the place to start. And all it takes is a phone and a phone call, and we'll be happy to help you.
Fantastic, Beth. Thanks for sharing that resource. And we'll be sure to post when we post. We'll post that number as well, so people don't have to scroll back through the video feed to get that number. So Nancy, I want to jump back to you. I mean, as you guys were already working on creating new opportunities, I guess, for mental health services in Lubbock following the Meadows Foundation report, and looking at gaps that we need to fill, areas that we need to work on. And now we have a whole lot more to deal with than what we did when that report was finished. What are some of the concerns that you guys have? What are some of the maybe new needs that have cropped up that we can start addressing and help folks to address?
Okay, so some of the areas that were identified by the Meadows report included services for children and adolescents and their families. And since the report has come out, there's been a lot of work that's been done in collaborative efforts across some of the founding partners. And so we are working to bring additional services to children and youth and their families and young adults in our community. Some of that is in partnership with StarCare. We also have other partnerships within the community, including Covenant and UMC and other areas. So one of the things that we do have is it wasn't just something that locally we were looking at, how can we address some of these challenges, but statewide we were also looking at what can be done, what are some of the challenges and what are some of the structures that we need to include some consideration for. And so through that, the Texas Children's Mental Health Care Consortium was formed. And they made recommendations during the last legislative session, and we were fortunate enough to receive some funding for all of our medical schools to provide additional training to some of our working professionals. So we now have a hotline across the state of Texas that practitioners can call. So this is nurse practitioners, this is medical physicians, these are pediatricians. And when you have a kiddo that presents in your clinic that is having maybe some health challenges, but they also have some mental health challenges, the practitioner can call. They will get a consult within 30 minutes with a child psychiatrist and see what are appropriate services for that child and for that family. So that is one of the services that we are now working collaboratively across Texas to provide, and Texas Health Sciences Center and the Department of Psychiatry are part of that. We also have another partnership that we're working on with our school districts, and we are providing telehealth screenings through the schools for families. It's a stabilization program, and the goal of that is to get the kiddos to the appropriate services and make sure that their families know what's available. And that again is separated out by regions. So we're not sending you to some place in La La Land or in a different state. We are actually connecting you with local resources in your community. And Texas Tech Health Sciences Center is part of that here in our West Texas community. And so those are some of the things that we've had to be creative and innovative, as Beth's already talked about, and how we can reach our community members, because something that works in Dallas or Houston is not necessarily going to work in West Texas. But we've had some great success partnering and learning from each other from the statewide consortium. So those are some areas that we are able to address based on, it was just timely. The Meadows found that we were lacking some of those services. And then we were able to have the state of Texas support building those services, because we weren't the only ones that had those gaps. So that's been promising. And we'll continue to grow those efforts. But as Beth has said, there's people that are utilizing mental health care services that haven't in the past. And so we've noticed a shortage, not only here in West Texas, but across the state of Texas and nationally, that we have a shortage of healthcare providers. So we're working to grow our training programs. We're working with StarCare for some of those. And so those are some of the ways that we are coming to the table to address mental health for our West Texas community and the families that live here.
And that's just so great, Nancy. And I think about, I'm a mom, so I think about the kids all of the time. In our household, we've got a 15-year-old and a 3-year-old, and how they have responded to everything going on has been vastly different. Obviously because of age, but one has the ability to express what she's feeling, and where my 3-year-old, he can only express it in tantrums, how he is feeling, and we are, especially as we're looking at going back to school and what school is going to look like, and it's going to look different for every family, I think, and how we make sure that kids and families have support. So it's great to hear that you guys are working on that issue specifically. Beth, do you have anything that you would add about concerns or things that moving forward?
The only thing I'd like to say is someone earlier mentioned about there's no shame in reaching out for healthcare. And I would tell you the only shame is not getting the help that you need, and that mental health is just as important as the rest of your body. Your brain is an organ just like your heart or your kidneys, and that no one would ever go without health care for another major system in their body, and that it's time for us to recognize that brain health is just as important as the rest of our body. So the only shame is not getting the help you need.
That is so good, Beth, and so important. I mean, I completely agree with you that there's far too much stigma around mental health and getting the mental health support that we need, and making sure that because when we get our mental health services, when we take care of our mental health, we're not doing that just for us. We're doing that for every person around us, for our family, for our coworkers, for our neighbors and colleagues. So we should always make sure that we're taking care of that as well.
Yes.
Thanks so much, Nancy and Beth and Cristy, for joining us today and talking through some of these issues. We will make sure we post links so that people don't have to remember those numbers. You can just click on that link and you can get there and get the help and support that you need. Again, there is no shame in reaching out and getting mental health support. It's absolutely the best thing that you do. If you feel even just the slightest need for maybe somebody to help talk through what's going on, that's okay. And it's important that you reach out and get that help. So thanks again, you guys, for joining us. Thank you, South Plains. We're in this together. We're going to keep trucking along, and we're going to get to the other side of this one day somehow, but we're all in it together. So thanks, South Plains. We appreciate y'all.
Thank you.
Thank you.
Hey, South Plains. We had a few technical difficulties yesterday when we were recording with Beth and Cristy and Nancy, and Cristy kind of dropped out of the call, but we really wanted to make sure that you guys got to hear from her and from Family Counseling Services as one of our partners. So invited Cristy back on today so that we could record that and add that back into the conversation. So, hey, Cristy, we're glad to have you back today.
Hey, Amanda, thank you for letting me come back. I know yesterday was crazy, but I greatly appreciate being able to tell a little bit of a story for y'all.
Absolutely. So, Cristy, just wanted for you to cover really quick, you do a lot more direct services with clients. That's a big part of your role at Family Counseling, and really Family Counseling in general, as y'all are really direct services, counseling services. So tell us a little bit about what the landscape looked like before COVID-19 and then what you guys are seeing more of now.
Right, before COVID, we were seeing a lot of people for individual therapy, but mostly substance abuse groups and anger management, domestic violence, and doing a lot more like group-based stuff. And since COVID, I feel like people are coming in more with this sort of lost feeling, and they're not sure where to go, and up is no longer up, and so everyone's just trying to navigate through chaos and madness. And also there are people who are needing parenting classes and substance abuse groups for not only their own recovery and journey, but it's mandated, and now everything's just kind of up in the air. And so I think there's a lot more stress, a lot more difficulty with financials, and what do I do with my kids, and my kids are home 24/7. And so that's more of what we're seeing, is just stress on stress on stress.
Stress on stress on stress. I think most of us feel that right now. It's just the compiled stress that is consistently it feels like being added to all of the time, especially now as we're thinking about heading back to school and making really hard decisions about what's best for our kids and what's best for our families, and what's best for our own employment. So Cristy, give us what people can do if they're really feeling that stress. How can they reach out to you guys? What services are you all able to provide right now?
Well, right now we are operating mostly through telehealth, which is great because you can now use a smartphone or a computer to access Zoom. And so we were able to utilize Zoom healthcare. So everything is secured, and anyone who's wanting individual, we're doing couples and family therapy over Zoom now, and just kind of bringing everyone into into a room together. So we are able to offer services online. And for those who, that's a little bit difficult for them to handle the technology, or there's barriers for that, they are more than welcome to come in, and we're practicing social distancing and disinfecting the office. I mean, after every single client or person's coming in, wearing masks, and so we're still functioning at actually an increased volume than what we had been. So there's no delay in services. If you want help, you can visit fcslubbock.org. Click on the sign up tab, fill out like a couple of questions, and we'll get someone to you right away.
That's so great, Cristy. And one of the things specifically what you guys do is you provide quality, affordable counseling. So talk to us a little bit, because I think a lot of times people don't take the step to get counseling because we think it's really expensive. So tell us a little bit about your model and what people can expect for that.
Yes, luckily we are able to offer very affordable rates as low as $0. So someone could come in and not pay a fee at all. We've currently waived the fee for anyone wanting to see a master's level intern. And these are people who are doing their practicum and internship through universities like Tech, Wayland, ENMU, WT, LCU, and they're right at the cusp of graduating with their counseling and degree. And so they volunteer their time. They're able to see clients via Zoom or in person. And so there's no fee to see someone, and they are more than capable and able to see clients, ranging from, anxiety, depression, up to more severe complex issues. And then we also have other affordable options that range from $20 a session to $40 per session. We also do accept some private insurance and Medicaid.
So cost should never be a barrier for getting counseling,
Never.
getting that mental health support. And that's the greatest thing about y'all's program is y'all are able to use interns who are getting practice and skills, but have supervisors who are helping them, on the more challenging issues that they're not experienced to deal with. Every intern has a supervisor that's supporting them as well. So, Cristy, we thank you guys so much for what y'all are doing. We'll make sure that we have the link to get to y'all's website and phone number so that people can call you and guys get set up for counseling. But thanks so much for re-recording this little bit so people can know what you guys have, and for everything that y'all are doing on a day-to-day basis. We appreciate y'all.
Thank you, Amanda, and thank you, Lubbock, for having us.
Well, thanks, Lubbock. Thanks, South Plains. We hope that we were able to share a little bit about mental health today and what it looks like in our community in West Texas, and make sure that people have resources and access. So if you do need mental health support, go ahead and get that. Everybody needs mental health support from time to time, and go ahead and reach out to one of the folks we've talked to today. So thanks, and we'll see y'all soon.